Good evening, good morning, good afternoon. I guess whatever it is depends on where you are. My name is Christopher Drake, and this is our first live webinar um, about the Buteyko Method. Some of you may not have heard of the Buteyko Method, I guess some have not, but I will start at the beginning nevertheless. More than 50, nearly 60 years ago, a Russian medical scientist by the name of Konstantin Pavlovich Buteyko made a great discovery. He discovered or made a delineation between people who suffer with chronic illness and those who don't suffer with chronic illness. In other words, in general terms, a scientific delineation between the healthy and the sick. I guess we should start off with the idea of chronic disease. Back in those days, when Professor Buteyko made his discovery, chronic disease wasn't called chronic disease. It was called, the category was called the diseases of civilization. And these diseases were conditions such as asthma, allergies, angina, bronchitis, bronchiectasis, cystic fibrosis, diabetes mellitus, emphysema, hormonal disorders, high blood pressure, obesity, sleep apnea, schizophrenia, and such things. These are a category of diseases which are, for example, not contagious, and they are also not congenital. In other words, you're not necessarily born with them, they're not a physiological defect, and they're not contagious. In other words, you didn't catch them on the bus or from the toilet seat. They are not transmitted by contact with other people. They are a category of diseases which seem to arise mysteriously. At this point, I should make mention, with all the tens of millions of dollars that have been spent on research into asthma, there is no official explanation for its cause. Insomnia, diabetes mellitus, high blood pressure, angina, multiple sclerosis, and all these conditions which we call which were called the diseases of civilization or chronic disease, official medicine doesn't have an official explanation for why they occur. And Professor Buteyko's discovery, or the ideas which he developed, which led to his subsequent approach for reversing these diseases, actually explains their occurrence. What Professor Buteyko did was actually measure the levels of carbon dioxide within human beings, and he found that those people who sustained these chronic diseases had a lower level of indigenous carbon dioxide, and those people that had an optimal level of carbon dioxide never ever sustained these kinds of conditions. The physiological norms were established in which a person, according to the founding fathers of modern scientific medicine, for example, should have blood pressure of 120/80. They should have a pulse of somewhere between 50 and 60. They should have a certain body temperature and so forth. These are called physiological norms. And it doesn't matter your race, ethnicity, or where you live, or the temperature, the environment. The Optimal blood pressure for a human organism is 120/80. The optimal body temperature is 98.6. The optimal pulse is around 50 to 60, and so forth. The optimal breathing or respiration for a human organism is around 3 to 4 liters per minute. And what Professor Buteyko found was that these folks that suffered this asthma, allergies, angina, bronchitis, bronchiectasis, cystic fibrosis, diabetes, emphysema, high blood pressure, hormonal problems, obesity, lupus, multiple sclerosis, sleep apnea, snoring, allergies, and so many other conditions, they number around 200, all share one thing. They all overbreathe. They all breathe enormously above what they should. Instead of breathing 3 to 4 liters per minute, which is the physiological norm, they would respirate at 6, 8, or 10 or so liters per minute. The idea which came to his mind perhaps occurred when he observed the newborn. And as mothers will tell you, when a child is brand new, so to speak, their breathing is almost invisible, undetectable. In fact, some mothers are actually quite terrified when they look at their child asleep and they are convinced that it's actually stopped breathing. That's how subtle, that's how light optimal breathing is. In contrast, if we go to the ward in the hospital for the terminally ill, where people are on the verge of death, you'll find that they invariably hyperventilate all the time. They breathe 10, 12, 15 liters a minute instead of 3 to 4 liters a minute. And as any nurse or doctor will tell you, at the time of death, basically the person is gasping for air. They are mouth breathing, and they are breathing vastly above the physiological norms. Professor Buteyko has an explanation for what this does and how this works, the effect of this kind of respiration. And what he discovered was that all people with asthma have the tendency to chronically hyperventilate. All people with allergies have the tendency to chronically hyperventilate. All people with diabetes mellitus, insomnia, sleep apnea, high blood pressure, multiple sclerosis, lupus, and so forth, all have this tendency to breathe vastly more than they should. I'm going to read from Professor Buteyko's own explanation or introduction to his method. I mean, he's the chap that developed it, so I should refer as much as possible to what he had to say about his discovery. This was written many years ago, so some of the dates are a little bit out of sync, but still, the basic premise is still relevant. 37 years have passed since I managed to discover the cause of some so-called diseases of civilization. The only cause of them is alveoli hyperventilation or deep breathing. The idea which came to my mind was that by decreasing the depth of breathing, or in other words, by the normalization of breathing, we could cure that range of illnesses. The idea was based on the fundamental laws of physiology, biochemistry, biology, and so forth, and the correctness of that assumption was confirmed by experiments and tests. The main postulates of my theory are: number one, it is known that while breathing deeply, the organism exhales too much carbon dioxide, and therefore its content in lungs blood and cells decrease. The lack of carbon dioxide caused by deep breathing changes the blood pH into the alkaline direction. Such a change of blood pH influences badly activities of all enzymes and vitamins. As a result, the whole metabolism suffers. And when the pH is reaching 8, the metabolism becomes improper to the extent that the organism dies. It is also known that a lack of carbon dioxide leads to spasms of bronchial, smooth muscle, brain vessels, heart, intestines, gall ducts, and other organs. At the end of the 19th century, the Russian scientist, Mr. Verigo, from the town of Perm, discovered a seemingly weird law. According to him, as a result of the fall of carbon dioxide in the blood, the bond between oxygen and the hemoglobin becomes stronger. This creates difficulties in the oxygen transition from blood to brain, cells, heart, kidney, and other organs. In other words, the deeper the breathing, the lesser amount of oxygen is available for the brain, heart, and kidney cells. This particular law, not very well known so far, underlies our discovery. As the Verigo law was left under wraps, the same discovery was much later made by a Swedish scientist and named the Bohr effect. Being unfamiliar with this law would have resulted in great difficulties in understanding and accepting the theory offered by us. At this point, I should explain more about this principle, because if you don't understand this principle, if you don't understand what we now know as the Bohr law or the Bohr effect, Buteyko's method doesn't make sense in a way. First, let me tell you a little bit about Christian Bohr. I'm not sure that he was Swedish. I was always under the impression that he was Danish, but it doesn't matter. His son was Niels Bohr, the Nobel Prize-winning biochemist, and the father's name was the man's name was Christian Bohr, and the law that he developed, or the principle he developed, is known as the Bohr law, and I'll explain what the Bohr law is right now. I might move the camera over here a little bit. As Professor Buteyko said, if you don't understand the Bohr law, then it's very difficult to understand Buteyko's method. So it's spelled B-O-H-R, the Bohr law, or Bohr effect. And it's actually very simple. The idea of it is as follows. Here we have, on this axis we have carbon dioxide, and on this axis we have oxygen. The very rate at which oxygen gets out of the cells and tissue to where it's needed, to get out of the blood into the cells and tissue and to where it's needed, is linear to the level of carbon dioxide. So this curve here is called the oxyhemoglobin dissociation curve. I haven't done it very accurately, but it gives you an idea. On this axis we have CO2, and on this axis we have O2, and this graph demonstrates the rate at which oxygen gets out of the hemoglobin, the red material of corpuscles, and the coloring material of the blood, and into the cells and tissue where it's needed. As you can see, a low level of carbon dioxide will comport to low oxygen uptake. A better level of carbon dioxide level will mean a higher level of oxygen uptake. And an optimal level of carbon dioxide in the organism results in the optimal level of oxygen uptake. So now we have a very strange paradox, because Most people would think that the more that you breathe, the more oxygen you will get. That's not true, because the level of oxygen in our environment is something like more than 10 times more than what the organism requires. So the air in which we live is much richer in oxygen than we are. Conversely, in the case of carbon dioxide, the opposite is true. The level of carbon dioxide in the environment is very, very small. It's around 0.035% of atmosphere. But the level of carbon dioxide that is required within a human organism to function properly is around 7%. That means we should optimally have 200 times more carbon dioxide in our organism than is within the air that we breathe. The result is the following. If we breathe more than we should, if we breathe deeply and more than what is recommended, the level of carbon dioxide in the blood will fall. And as it falls, that will mean a corresponding reduction in the level of oxygen that gets out of the blood into cells and tissue. So here's a great paradox for everybody. Whilst everyone will tell you that the more you breathe, the more oxygen you'll get, in fact, the reverse is true. If you begin to hyperventilate, if you try to breathe as much as you can, deeply with the mouth open, and you try to make as much gas exchange as you can, within minutes you'll begin to feel dizzy. Within minutes, if you're asthmatic, you'll begin to get a tight chest. Within minutes, those who suffer with a high blood pressure can watch their blood pressure even increase more. And all the symptoms which constitute these chronic diseases are all exacerbated by an increase in breathing. Why does this happen? Well, according to Buteyko's idea, his method, and the discovery of Christian Bohr, it's very simple. If you overbreathe, you breathe more than you should. As a consequence, the level of carbon dioxide will fall. As a consequence of that, less oxygen will be delivered into cells and tissue where it's needed. And of course, that will contribute to one's symptoms. So it's a great and peculiar paradox that Bohr discovered and that Professor Buteyko incorporated into his discovery and his method. So if I may, I'll continue reading from Professor Buteyko's introduction. This particular, I'll just read the last few words from where I left off. This particular law, not very well known so far, underlies our discovery. As the Buteyko-Bohr law was left under wraps, the same discovery was made by a Swedish, I think actually Danish, scientist, and named the Bohr effect. Being unfamiliar with this law would have resulted in great difficulties in understanding and accepting the theory offered by us. The lack of oxygen in the brain, hypoxia, caused by the deep breathing, is aggravated by broncho and angiospasms, the organism's attempt to compensate for hypoxia of vital organs, and produces arterial hypertension and so forth. Consequently, the blood flow increases and blood supply to the organs improve. Along with the lungs, hyperventilation, the hypoxia creates a false feeling of lack of air accompanied by intensified breathing. In other words, hyperventilation leads to an increase in hyperventilation. This leads to an inevitable progression of the disease. Carbon dioxide deficiency in nerve cells stimulates the whole nerve system, and that makes the organism breathe even deeper. Thereby, the nerve cell hypoxia, along with upset metabolism and overexcitation of the nervous system is causing weakness of the intellect and destroying the nervous system. That's also known as brain vessel sclerosis. That finally leads to a mentality dysfunction. Destruction produced by deep breathing is aggravated by poisoning of the environment and food with chemicals, herbicides, and medications. If it is so, then all of Western medicine's main principles are based on methods of prevention and treatment, consisting of teaching people deep breathing techniques, exercises, and bronchodilatory medications that increase the rate of CO2 removal from the body. They do not improve, but worsen the state of already ill patients. That is why so-called diseases of civilization are not yielding to treatment, but spreading even further. The discovery of the fact that deep breathing is the main cause of those illnesses allows us to prove scientifically and experimentally that existing principles and methods of treatment are faulty. The hyperventilation test offered by us represents incontestable evidence of the correctness of our discovery. That hyperventilation test is very simply when I asked you, try to breathe deeply. Breathe as deeply and as fast as you possibly can. And those of you who suffer with insomnia, sleep apnea, asthma, allergies, angina, high blood pressure, or any of these diseases of civilization, you can aggravate the symptoms of those conditions, and by doing so, you prove the point that further loss of CO2 will further deepen and create more symptoms. The idea of the test is to ask a patient to deepen his breath and check how the widespread recommendation, breathe deeper, affects that person. In a few seconds or minutes, the hyperventilation test provokes or intensifies symptoms, while the lessening of the depth of breathing quickly stops them. This means that the only scientifically explained principle for prevention and treatment of the illness of the century is a decrease in the depth of breathing in order to normalize its physiological function. Based on this idea, the method of the intentional normalization of breathing, or in other words, the deliberate volitional breathing method, DVBM, was developed. Now, DVBM was the name that Professor Buteyko gave to his method and approach for normalizing the breathing. When his protege, Alexander Stalmatsky, came from the former Soviet Union to the West, Alexander, this is going back 20 odd years ago, 21 years ago, we didn't think that the DVBM or the intentional normalization through volitional liquidation of deep breathing was a very good name. So we decided that we would call it the Buteyko Method. And in doing so, we made a kind of misleading, we gave it a misleading name because, okay, we called it Buteyko after Professor Buteyko, which is fair enough. But we also called it Method, which, due to Alexander's poor abilities with the English language and my knowledge of Professor Buteyko's ideas, we agreed on the name Method. And it's not really a method because the term method implies a systematic, orderly approach to get something done, which theoretically is kind of true, but depending on the kind of disease that one has, depending on the degree of correction one's breathing needs to undergo, the word method oversimplifies it. So it's now known around the world as Buteyko's method, but, well, the term method is not as accurate as it could be. The principle of it is the decrease of the depth of breathing by deliberate efforts made by the patient to relax respiratory muscles until a feeling of some shortage of air. All mentally sound adults and children from the age of 3 are able to learn the method. Our ideas can be used on a broader scale, starting from antenatal training of prospective mothers, caring for infants, teaching children some physiological norms, and finishing by the implementation of the General Health Improvement Program for the entire population. The ideas can also be used in space medicine, surgical practice, pedagogy, singers training, and sport. In common opinion, the medicine, similar to many other sciences, needs to be radically reshaped. We are seeing our ideas, along with other progressive but previously rejected ideas, as a foundation of the future medicine. We believe the first and foremost task is to give people the information about our discovery in order to stop the deep breathing propaganda by radio, television, and mass media, and to cancel the deep breathing exercises at hospitals and clinics. The complete victory will come when the whole civilized world realizes the deep breathing principle of greed is the worst of human vices, that it is the source of almost all troubles, the main cause of disease and death for the overwhelming majority of human beings. So that was Professor Buteyko's introduction to his approach. But, well, I guess if you are interested in improving your health, vitality, if you are interested in reversing your asthma, your allergies, your angina, bronchitis, bronchiectasis, if you have some hope that you might be able to reverse the breathlessness which comes with emphysema, and what I've just written out, what I've just read out to you might sound a little abstract. So we need a more practical handle around which we can grasp this idea and somehow make use of it. We can start with a very simple exercise if you want to measure your breathing. How much do you breathe? Well, you can find out by going to a hospital and to a respiratory laboratory, spending a few £1,000s or whatever, and spending some days there as they check your breathing night and day under exercise and when asleep and so forth. It's an awesome task to properly measure a person's breathing, but Professor Buteyko developed a very simple technique. It's called the control pause, and I'll show you how to check your control pause even now and within a few seconds, and you can very quickly understand your breathing, and if your breathing in fact has anything to do with your level of health or your chronic ailments and so forth. The control pause is just very simply a maneuver whereby after a normal exhalation you hold your breath and count the seconds until you feel the urge to breathe. So the control pause you would do like this. You would make a breath in and make a breath out, a normal breath in, a normal breath out, and hold your breath. And you hold your breath, and whilst you're holding your breath, you record the number of seconds that transpire. So watch this. Breath in, breath out, and hold. And as you're holding your breath, you count the seconds. At a certain point, your respiratory center will become provoked by the increase of carbon dioxide that occurs as you're holding your breath, and you will feel the urge to breathe. You will feel some discomfort. At this point of discomfort, you stop doing the control pause, release your nose, and remember how many seconds that transpired. So once again, you make a breath in, You make a breath out, you hold your breath, and you count the number of seconds that transpire until you feel the urge to breathe, until you feel some difficulty. Now you might be able to hold your breath for 10 seconds, 15 seconds, 20 seconds, 30 seconds, or even 60 seconds. If you can effortlessly hold your breath after a normal exhalation for 60 seconds, it means your breathing is basically perfect. It would indicate that you breathe around 3 to 4 liters a minute. If you can only hold your breath for around 30 seconds before you feel the discomfort, it would mean that you breathe around double. You breathe twice more than what is physiologically recommended. If you can only hold your breath for around 20 seconds, in other words, you make a breath in, you make a breath out, you hold your breath, and after 20 seconds, you feel discomfort, and you need to release the breath holding, it would indicate that you breathe 3 times above what is recommended. And that is pretty much common today for most so-called healthy people. They can hold their breath effortlessly after an exhalation for somewhere between 15 and 20 seconds. But it also means that they breathe 3 times above what is recommended for an adult human organism. And likewise it continues. Some people can only hold their breath effortlessly for 10 seconds, 8 seconds. Usually when a person is in the state in which they're about to pass on from some terminal condition, they can only hold their breath for 2 or 3 seconds, even less. Those who are chronically ill with serious illnesses, they have control pause 8 seconds, 10 seconds. And those who are having lots of medications and lots of health problems often have a control pause 15 seconds, right up to 20 seconds. Those with a control pause of around 20 seconds, they're not in ideal health, and they will have problems and difficulties with their health. Those who have a control pause of 30 seconds are generally exceptional for these times, and those who have control pause of 40, 50, and 60 certainly are very, very rare indeed. Professor Buteyko was alarmed by when he made his observation that the control pause for human beings, for civilized people, is dropping, is getting lower. Maybe it's for some reasons of philosophy, maybe it's for some reasons of toxic environment that we live in, maybe it's because of stress, maybe it's so many multifactorial things all playing their part. But it is the case, and all practitioners who have been practicing for some time recognize the fact that the breathing of the general population is deteriorating, and as a consequence, asthma, allergies, angina, ADD, ADHD, stress levels, cardiovascular disease, and all these chronic diseases are actually ramping up. Diabetes these days is relatively common to what it was 20, 30, and 40 years ago. So these chronic diseases, these diseases of civilization, are becoming more prevalent. Multiple sclerosis 50 years ago is an extremely rare and unusual condition. Multiple sclerosis today is comparatively common. Likewise with diabetes. Depression 50 or 60 years ago was comparatively unheard of. But in this day and age, depression is extremely common. So most people would like to live a normal life and have a normal level of health. But when we look at what normal is in our societies today, we see that cancer is normal. We see that asthma is quite normal. to be over 40 or 50 and have high blood pressure. It's normal to suffer stress. It's normal to have insomnia, nothing exceptional. And to snore at night, well, I think, you know, perhaps 8 out of 10 houses at night, one can hear the sound of snoring and so forth. Sleep apnea, at a time not so long ago, sleep apnea was extremely rare. And today sleep apnea is a booming medical industry. Well, this is our first presentation. And are there any questions, Abner? Okay. Don't laugh, you know, because if you look at even CBS and NBC and the BBC, when they started, you know, their first broadcasts were pretty amateurish, and we're also pretty amateurish. We want to become more professional, and I'm hoping in the times, in the course of time, our online presentations will get, you know, more interesting and more and so somehow slicker. I've got no messages here. I'm sorry.
Workshops.
Workshops. Okay. So what can I say now? If you go to our schedule on learnbuteykoonline.com, you'll see our ranges of presentations. I believe tomorrow we're going to do a presentation which is specializing in the area of asthma. And it should be noted that, for example, asthma is a condition that according to medical journals, according to medical history, there was basically no incidence of asthma that caused death. So there were no asthma deaths actually until the introduction of bronchodilating medications which relieved the symptoms. So if you analyze it carefully and think about it, you'll realize that asthma medications have the tendency to increase the aperture of the bronchivessels, making it easier to breathe, which is great, well and good, relieving the symptoms. And so asthmatics are very happy that they can relax a little bit because their bronchus is not so tight and not creating that discomfort. But on the other side, on the other hand, by the organism in its attempt to keep its level of rare carbon dioxide constricts the vessels. It creates these symptoms. It creates these defensive mechanisms to preserve the integrity of the organism. And it's true, it's uncomfortable and unpleasant, but that's the organism's way of dealing with chronic hyperventilation. For those who are genetically predisposed to manage their hyperventilation with asthma symptoms, that's what would happen. They would have tightness in the chest, they would feel terrible, of course, but the organism's level of CO2 is maintained. By using a bronchodilator, the defensive mechanism is broken and more carbon dioxide is allowed to escape. The organism answers with still yet a stronger spasm, and so now this defensive mechanism and bronchodilator use somehow ratchets up the condition until to such an extent that the bronchospasm can actually fatally affect the patient. So here is the example of a condition whereby the symptomatic treatment of asthma actually worsens the underlying condition. The reason behind asthma is chronic hyperventilation syndrome, and the treatment, the conventional treatment for asthma, is bronchodilating medications which unfortunately fight the defensive mechanism, deepen the condition, and make it worse. The same can be, on a similar level, can be said with high blood pressure, diabetes, and many other conditions, whereby the real cause of the condition is not addressed at all. Instead, the symptoms are addressed. And the symptoms are not a disease, but the body's attempts to normalize its function. So I've got a message here. And, right, message from Stella. Well, tomorrow we're going to have a talk at the same time, specifically on asthma. Stella asks, how do I get started using the Buteyko method to improve my asthma? Well, tomorrow I'm going to give practical tips on how people can reduce their breathing and how they can overcome their symptoms. I would recommend that if you can make it tomorrow, I believe it's the same time as this presentation was. It's free of charge, of course, and we'll have a discussion specifically on asthma and how to improve your asthma condition. If you take medication, bronchodilators, and if your asthma is severe, then we would recommend that you do at least a basic online training course. We run courses online whereby we teach people, Buteyko's exercises on how to improve their levels of carbon dioxide and how to overcome symptoms. But tomorrow, at tomorrow's webinar, we will go straight into some practical issues on asthma and how to improve the condition. Usually, if a person takes medications, they actually they have to recondition their breathing. They have to change the sensitivity of their respiratory center and change their breathing pattern. It's a big job. It takes time. It requires coaching. You have to practice. I can't say it's easy. I can't say that changing your breathing is easy, but most definitely, if you have asthma, you'll be able to reverse your asthma symptoms, and it's noticeable within days. If you have regular symptoms, you'll notice that within a few days your symptoms are either less, significantly less, and that within days and weeks it's very obvious that as your control pause improves, your asthma symptoms diminish. Patrick asks, how do I get started with the Buteyko method? Well, we would recommend that you do a course. We have a basic introductory course, and we have which goes for 5 consecutive days. We also have 2-week courses and 1-month courses, depending on the severity and how much coaching and how much training a person needs to become skillful enough to reverse their diseases, augment their health, and to normalize their breathing. But at least if you do a basic course, regardless of how severe your condition is, you'll be able to at least see how to improve the situation. And if you improve the situation, well, then it's obvious you're in the right direction. But I should, to make it plain, some people, small children and so forth, it doesn't take them long to get vast improvement. Older people with more medications, more complicated conditions, lower control pause, more and more years of hyperventilation, the job is bigger, it takes longer, they have to work harder, and yet the results are even more extraordinary because of the contrast in their health which they can bring about through skillful application of Buteyko's techniques and exercises that he developed. Hans says, I see that you encourage us to join workshops. How do they work? Well, in the workshop, the idea is very simple. To reduce the breathing. That's it. I can tell you the whole method in one sentence. To reduce your breathing. reduce the depth of your breathing, and to normalize your breathing. The problem is that we breathe for 24 hours a day. We breathe when we're asleep, we breathe when under exertion, we breathe when we're under stress, and all kinds of things affect our breathing. The thing which affects our breathing the most is the fact that it is governed or controlled by what's called a respiratory center. The respiratory center is in the brain, and this is the, see, I can basically demonstrate how you should breathe, but the problem is that, would you be so kind to hold this for me? Can they see that I should have been an artist, right? Okay, so it goes like this. Here, in the medulla oblongata part of the brain is what's called the respiratory center. And the respiratory center is sensitive to the level of carbon dioxide. So therefore, the reason why we don't breathe because we need oxygen. We do need oxygen, but that's not the mechanism which causes us to breathe. What causes us to breathe, or what regulates our breathing, is the level of carbon dioxide, alveolar CO2. When that reaches a certain point, it's supposed to be around 6% or so, it sends a trigger to the respiratory center in the medulla oblongata. And that respiratory center then triggers the vagus nerve system, intercostal muscles, and it actually produces that feeling of air hunger. For example, you know when you hold your breath and after a while you feel like you're suffocating? Most people think that's an oxygen deficiency. It's not. That feeling actually is produced by the respiratory center, and it is accompanied with stimulus to the intercostal muscles and vagus nerve system. In fact, it's not a deficiency of oxygen that you're experiencing. It is a higher than normal level of carbon dioxide, because it's carbon dioxide that regulates and causes your breathing, the mechanics of the urge to breathe and so forth. That's fine, thank you. So the idea, the primary idea of am I straight on now? Yeah. Of the Buteyko method is to retrain the respiratory center. It's not psychological. It's not mental. The respiratory center, like the vasometer, is located in the medulla oblongata part of the brain, and it is responsible to keep a homeostasis of our ventilation patterns. So if you breathe 3 or 4 times more than you should, as a consequence, the body loses lots of CO2. But the fact is that in order to change your breathing pattern, you will need to recondition. You will need to change the sensitivity of CO2 to your respiratory center. So, to go back to the question, what's involved in a workshop? Well, we show you how to measure your breathing properly. Then we go through a whole range of lifestyle habits that you can change that will make it easier to practice Buteyko method, and then we go into various breath holding techniques. Professor Buteyko developed a very particular approach to breath holding, which in yoga is known as a kumbhaka practice, breath holding and various other techniques to recondition the respiratory center so that your involuntary breathing pattern changes. When you enter this workshop, you'll be a person who has a control pause of 8 or 10 seconds or 15 seconds or whatever. And when you finish the workshop, our objective is that your control pause has improved significantly, and that involuntarily, without much effort on your part, you now are a person who breathes significantly less. I should mention at this point, will you be able to perfect your breathing in 1 week? or in 10 days, or in 1 month? It's unlikely. What is likely? That you can dramatically improve your symptoms, dramatically make your symptoms less, and work to perfect or to bring, for a contemporary person, to make their breathing optimal according to the physiological norms, can take months of work, even years. That's sort of off their high blood pressure, their asthma, their migraine headaches, their allergies or whatever, and they're not always disposed to, you know, optimizing their up to the individual. You look a bit perplexed there, Abner. Are we okay?
One error.
One, Susie, how can we go about finding out how to change our breathing? Well, that's what we do. That's our job. Our job is to teach you Buteyko's method. Is it going?
Errors.
Errors?
Yeah.
Oh. Am I going online? Am I going across? Okay. One gentleman says, I suffer from geographic tongue, which is an autoimmune condition, cause unknown, but mainly thought to be caused by stress. Are there any studies, benefits for geographic tongue? To be honest, despite the fact I've taught over 20,000 students and I've been doing this for more than 2 decades, I haven't heard of that particular condition. But you've mentioned here that it's an autoimmune condition. And what I do know is that all autoimmune disorders are vastly improved with Buteyko Method. That's what I've seen. Lupus is autoimmune condition, Crohn's disease is autoimmune condition, MS and so forth. These are autoimmune conditions. You see, the rate at which the antibody bonds to the antigen is linear to the level of carbon dioxide. So as you improve your level of carbon dioxide, I would expect any inflammatory or autoimmune condition to improve, not be cured as such, just like that, but to improve to the degree at which your levels of CO2 improve, and that would be indicative on how your breathing improves. Melissa asks, I understand that this method helps chronic fatigue. Is this really possible? Well, first of all, who knows what chronic fatigue is a name given to always feeling tired and weak and sick and poorly and so forth. And then they categorize it and call it chronic fatigue. I've treated literally thousands, I've taught thousands of people who have chronic fatigue, without exception. Without exception. As their control pause improves, their symptoms also improve. But in some cases, it's what they call fibromyalgia. In some cases, it's we're not going ahead.
Just on cutting out for the reason.
Okay.
Keep it short and then.
All right. We're having some technical difficulties here, so sorry about that. There's been numerous articles. If you go to our website, you can see some several testimonies from people with chronic fatigue. Some people suffer chronic fatigue because they've been poisoned with toxic chemicals. We've had success with that because the method has a tendency to cause the body to discharge toxins. So chronic fatigue caused by toxicity has helped. It's not a quick or what you'd call a miracle cure or instantaneous or so forth, but the results are linear to improvement in the breathing. And then there's other kinds of chronic fatigue, fibromyalgia, which has some other causes and so forth. So we've had very good success with chronic fatigue. But once again, I would stress the point, it's not necessarily easy to practice this method. And it can take some weeks or months of practice before you're at a stage where you can so-called live what you might call a normal life. But is there linear cause and effect improvement according to your practice? The answer is yes, absolutely. As your control pause improves, so you will see the degree that you sustain the symptoms of chronic fatigue will diminish. I'm used to speaking to groups that I can actually see. And what's happening now is I'm looking at this little camera, so it's different for me. Right. If you have any questions or you would like to have a free consultation, myself and our group of facilitators and practitioners will be very happy to email you or to call you up. If you would like to know the specifics, I know that this presentation, I have tried to explain 40 years of Professor Buteyko's work and 20 years of my own practice in the space of an hour, using a system, this webinar, which I'm not very good at, I guess, but we try to bring this idea out to as many people as much as we can, because, well, if you do the investigation and you do the sensible checking, you'll find that Buteyko's ideas are consistent with biology, physiology, biochemistry, and if you do make the inquiries and do the research, you will find that the results we get and the explanations we give are authentic. We may not be very professional in a way of transmitting this information, and we may not be slick or what do you call it? Well organized as we could be, but at least in terms of the claims that we make and the ideas that we put forward and the things that we do, you will find that it's authentic. It's real. It really works, and I would completely understand people for being cynical. Just about everything you look at these days is over-promoted, under-delivered, and unreliable. That's not the case. That is the case with us as people trying to get our things done and do what we can do. But it's not the case with Buteyko's method, his philosophy, and the approach that he gives to reverse disease. His approach is incontestable, unassailable in terms of the cause and effect. And it is our job, as much as to the extent that we can, to deliver his approach, his method, his ideas, his discoveries, and to make them available and to, so that people can become skillful in this, and you can, through your hard work, persistent effort, and becoming skillful, reverse these chronic diseases. That's what our message is. That's what our idea is. All the rest of our organization, operation, well, we are just very much trying to deliver this. And well, for nearly 20 years, for over 20 years, we just relied on word of mouth and publicity that would come from time to time in television documentaries in different countries, and also favorable newspaper articles and so forth. And that would give us enough work to work with groups of people and so forth. But then more recently, we noticed that the newspaper articles aren't yielding the kinds of results. The costs for promoting and making this available, and we don't get support. Well, we do from individual doctors. A lot of doctors support this method and have testified to its authenticity, but we don't really get the sort of support from the establishment, if you will. and so consequently we're marginalized. Well, we're not complaining about that. We've always been in our own category somehow. And so in order to bring this to a wider audience and to more people, and in order to save, well, to put it frankly, what was happening was that most of our time, effort, and energy was actually going into the promotion, and the costs, most of our costs, were also going into the promotion and the venues and all the administrative work that takes. And so coming online this way was our way to hopefully put a cap and in fact reduce the expenses that we must pass on to patients so that we can make this Buteyko's method more available and more affordable for more people. So that was that's the idea behind this. I'm going to be surprised if anyone is still watching. Okay, well, so please, if you've got any queries, if you'd like to have a consultation with somebody about your particular situation, or you've got questions that I've been not able to, or I haven't answered, or you didn't understand, please be in touch with us, and we will try to get back to you as quickly as possible and explain the best way we can. Tomorrow at this time, we're going to give a presentation specifically on the treatment of asthma. The Buteyko method was trialed. There are published medical trials. It's the disease, I guess, particularly in the early days, whereby we treated literally tens of thousands of asthmatics in Australia and throughout the world. And so in the area of asthma, our results are extremely well documented. And so we'll be going over that, and also trying to give some accurate tips to people, what they can do to improve their asthma situation and what they need to do to take off their asthma. I think, is that it? So this is, you are witnessing a historic moment, the first live webinar about about the Buteyko method, as far as I know. I wish you well and look forward to hearing from you, and I very much thank you for your time and your interest to watch this broadcast. Is that it?
Yeah, I think so.
I'm relieved. What do you think?
Very good.
Very good?
Yeah, I'm still kind of, I'll be busy for a little bit, just.
Okay. This still says live here.
I know.
Stop screaming.
Have you stopped it? I think it's more like, should be done that way.
How many people were watching?
13.
Oh, it's still going for
Yeah.